Hey folks, this is Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas. And I'm coming to you this week with a brand new blog, a brand new thought. This one is called, Should I Stop Exercising When I Have Back or Neck Pain? And the answer is not at all, but sometimes yes. Clear as mud, right? How do you know the right thing to do? Well, let's talk through it. I'll give you some general guidelines and thought processes that you can consider. These are kind of random thoughts, not particularly well organized either. I was in a hurry, but there should still be plenty of takeaways that you can learn from. So let us start with the obvious. If an injury is severe and you suspect it to be an emergency, well, go to the emergency department, the emergency room. Don't fool around, don't try to exercise, don't lay at home, go to the hospital. Now, outside of emergent conditions, now that's what we're talking about. Have you ever known somebody that had surgery? Surgery like having their appendix removed, maybe a hernia repair, or a new mother that had just recently had a C-section. If you know of someone that has gone through these things before, then you may recall something that's pretty shocking to some. And what I'm referring to is the fact that the medical staff has these surgical patients, they've got them out of bed and walking the hospital halls the very next day. Now this sounds like ancient medieval torture on a scale with what Mel Gibson endured at the end of Braveheart, right? But I assure you, it is not. Research has been very clear on this. Movement is healing. Movement is healing, remember that. Those that lie in bed awaiting some magical healing to occur, those people actually do worse in the long run. And not only do they do worse, but the recovery takes much, much longer to achieve. That is why, no matter how detrimental it may seem, or how counterintuitive it may seem, new surgical patients, they're up and moving. And we can correlate that thought process with back and neck pain as well. Research has an answer on spinal pain as well. Those that have painful backs, you guys need to be moving. They need to exercise to the extent that they can exercise and tolerate it. But they need to exercise correctly, in the right way, and do it safely. Going back to the gym and muscling through a bunch of the stuff you always do, probably actually going to make things worse. You need a trained professional's advice to get you back to being active and doing it safely. Active in a way that does not cause the pain to come right back or even maybe get worse than the original injury. Now, let's talk about fear avoidance. A good start here is to recognize the difference between hurt and harm. And there is a big difference between hurt and harm. And many times when we're recovering, certain activities can hurt. As long as they don't seem harmful, they are typically acceptable and encouraged. If a patient feels a particular activity is actually harmful, well then they're expected to stop that activity and or modify it to the point where it can become tolerable. The last thing that we as practitioners want is for the patient to fall into what we term fear avoidance. And this is where the patient begins to avoid normal activities of daily living. And when patients start avoiding normal activities because they're afraid that hurt means harm, well then the patient begins a long, slow downward spiral into chronic pain syndrome. Obviously, that's not desirable. It is vital to push through many of the things that may be painful in the beginning. Pain and movement are mental games as much as they are physical. And once one convinces themselves that they can't do something or that it is unsafe for their body to try it, well, then we lose more and more capability. This loss only continues to get worse and worse and worse as time passes. So what kind of exercises are okay then? We have established now the general concepts that movement is healing, that movement builds confidence in your abilities to recover, and that movement helps avoid fear avoidance. Knowing that movement is usually encouraged, let's now talk about what movements make the most sense. If the pain shoots into a limb, such as an arm or a leg, well, you should visit your closest evidence-based chiropractic office that does exercise rehabilitation so that they can offer you exercises based on the concepts of nerve flossing or nerve gliding combined with McKenzie exercises, and maybe even some over-the-door traction or some non-surgical spinal decompression to help calm those nerves down. Now, these are great options, but let's face it, we don't really exercise our necks all that much. You can, they have neck machines, but for the most part, people don't go to the gym and they look for the neck machine, do they? The more used area of our body in the gym is the lower back. If the area of pain is in the lower back, well, the key there is to nail the diagnosis and to remove the trigger that started it in the first place. And we know that patients under 50 years old that go to a clinic of any kind with low back pain, we know those patients, that low back pain, it breaks down as follows. Disc herniation or a bulge, about 40% of them are disc herniations or bulges. The next in line of prevalence is facet pain. About 30% of back pain patients in any clinic are facet pain patients. And then pelvic pain, about 22.5% of the low back complaints that you'll see in a clinic are due to pelvic pain. And then we can break those numbers down even further. And typically, low back disc injuries, the most common, the most prevalent condition, low back disc injuries hurt over the midline in the back, right in the center. And those patients like to extend at the waist or bend backwards. Walking usually helps these people. Sitting is usually the worst. Lying down is usually the best position. Coughing and sneezing many times hurts, and on and on and on. Now, facet pain, for example, does not like extension at the trunk, especially when you add any sort of rotation to the extension. That is no bueno for these patients. They hurt a little out to the side of the spine rather than in the center, and they don't like it when you apply a little bit of pressure on them. It makes them real mad. For the pelvis, sitting to standing, going from a seated position to a standing, hurts. They usually can locate their pain below the belt line and further out to the side. And walking is not good for these patients. They hate it. Remember, discs, they love walking. So there are certainly other conditions that can cause pain in the low back, things like sprain, strain, and stenosis, and more things. But these are the three big ones that we usually see the most. And as you can see, an expert would prescribe different exercises for different conditions based on being able to nail that diagnosis. The determining factor in the resolution of a complaint is getting the diagnosis right, because that's what you base your exercises and your treatment on. For example, in a disc herniation patient, the majority are what we would call extension bias. They like going backwards. They hate to bend forwards at the waist. I would recommend a good healthy dose of extension biased exercises. And these enable the patient to mitigate the pain at home. Many disc herniation patients have pain, numbness, or tingling into a leg. Well, in that case, there are nerve flossing and nerve gliding exercises that can help control that symptom from the house. And in these patients, we don't want them in a car for a long time, sitting and bent forward at the waist. We don't want any patients doing traditional sit-ups really ever for any reason. Even if you've never had back issues, there's no reason to do sit-ups and bend at the waist like that. We don't want these patients doing leg presses or squats that apply load to an already injured disc. It needs time to heal. So, however, though, walking is an excellent activity for these patients. I would say swimming is probably a great exercise for these patients. So those are just some general ideas. Not every patient is the same, and so their exercise prescriptions should not be the same either. But here are some of the key takeaways. There are too many variables, like I said, to give recommendations in a blog or a video. But the key takeaways: movement is healing. Movement builds confidence in your ability to recover. Movement helps avoid fear avoidance. Recognize the difference between hurt and harm. Continue moving through an injury, but it's best to speak to an expert, evidence-based chiropractor first. Each type of injury requires different kinds of exercise to perform, as well as different kinds of exercises to avoid. For a low back injury, learning to keep your spine stiff and straight and strong and neutral goes a long way toward removing the triggers that probably started the issue in the first place. And thank you to Dr. Stu Miguel and Dr. Tim Bertelsmann with ChiroUp for that. Abdominal bracing. Now, when preparing for a load, be sure that you are properly bracing your abdomen, and make sure that that is commensurate to the activity that you are about to undergo that requires the bracing. So the same amount of abdominal bracing is not required to lift a car as is required for bending over to pick up a small box on your front porch. Brace for the occasion. So I hope that I have helped to answer some of your questions, even though it's kind of a shotgun approach and random and here and there. I know I gave you some tidbits that you can certainly take home and put in your pocket for future use. The biggest points to stress here are to not stay home lying in bed and avoiding things that you love, that feed your soul and your life. Don't avoid those things because you're afraid that it's going to hurt, and that you're afraid that hurting means harmful. Okay, so stop avoiding things. Get out there. Start slow and steady. Progress at about 10% each week if possible, and do not, whatever you do not let pain take control of your life. There's too many options to getting rid of it. Fight it. Fight it back by remembering that motion is the lotion for your joints. And though it may be a bit sore in the beginning, this too shall pass. I hope that helps you guys. I hope that gives you some things that you can chew on and think about. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. I am our area's only fellowship trained diplomat in the International Academy of Neuromusculoskeletal Medicine. So if you've got an issue, I bet we can help. Call me at 806-355-3000. We'll get you worked in.